Hello and welcome back to Tooth Truth Live. We are joined today by Dr. David Gonzalez, who specializes in orthodontic treatment, and we're going to ask him some of your questions that have come up about braces and
happy to.
Yeah, and all of why that's so important. So, first question is, kind of a broad one. Why do you feel like the smile is so important?
Well, from the when I was in my residency program, I actually had to do a justification for my research. And one of the things I did was look at why do people smile and why is it important? And simply put, when you look at anybody and you meet somebody, their smile reflects how they respond to you. Are you happy? Are you sad? Do you like me? Do I like you? So when you have a smile that you're not proud of, what happens is you don't smile so people think you're upset or they think you're mad or you're not receptive or you're not friendly. So as time has evolved, and now with social media, the visibility of people smiling and being on social media or on pictures has skyrocketed. Mm-hmm. So the smile now is so important, and most people are aware of it. It's always been important, but more than ever, that smile is kind of a reflection of the person inside, and whether we like it or not.
Right.
It is.
Right. Very great. Good. So smile is important. We know that, but it's interesting to think psychologically how the smile impacts us and the way we interact with others.
As an orthodontist, one of the things that I think is the biggest impact is I'll have a child or even an adult who comes in and is they're perceived a certain way, and then they go through the initial stages of braces. They don't even complete them. They just have a better looking smile. And people say, "What's different about you? You seem like you're happier," and it is really just the fact that the person is not so concerned about the way they look when they smile. Yeah. So they smile more, so people are more receptive. So again, it's a very odd thing, but really when you think about what makes us us, it's really from the neck up. And eyes and the smile are a big factor.
Yeah, awesome. The other thing, I feel like a lot of parents are noticing kids younger and younger in braces. And, that seems to have changed from my generation and your generation. So talk a little bit about where that philosophy's changed or why we're seeing that more frequently now.
Well, the reason it's been more important is that I kind of go back to when I was a child. When I was in the 5th or 6th or 7th grade, 6th grade seemed like forever. 7th grade seemed like forever. So when you have something that you're not happy with, even if it's just your front teeth, and we know all the teeth aren't there when you're in the 5th or 6th grade. So we see more and more that people don't want to wait till all their permanent teeth are there.
Right.
Now, there's a lot of reasons we do early treatment, and I don't really like to call it early treatment. I like to call it age-appropriate treatment. But more, we're having people who say, I know that it's a little earlier than normal, but my son or daughter would like to have a beautiful smile in the 5th, 6th, and 7th earlier.
Right.
And there's no doubt, and I've seen it, that it makes a big difference, because when you're forming yourself, as you look back and it happens earlier than the 7th or 8th or 9th grade, which are typical times for braces.
Right.
So when they get something done earlier, there's no doubt it's a boost of self-confidence. Right. And again, you can do things later, but more and more they want the smile done a little bit sooner.
Now, what about taking, because some of the things I've heard too is taking advantage of that, of the growth in a child. So, if a child has not just crooked teeth, but maybe their jaw alignment is off or some things like that, because I feel like I see that a little bit too for early treatment.
Absolutely. When you see in the media now, you see really two big things that are out there. And one of the biggest is sleep apnea. When a child is growing, the way a child grows is they grow from basically the back of the head to the face. Example is when you see a young child, their eyes look so big. That's because growth up here far is in excess compared to the lower jaw. In fact, the lower jaw is the last thing to grow. So when you have somebody who's young and they have a bite, and the most common bite we treat is basically, it's simply said buck-toothed. And that's basically, and I'm going to use my hands here to show you, it's when the teeth are like this. So when the teeth are out like, and the lower jaw is like this. And because of that, if we catch somebody at an earlier stage, we can correct that by basically channeling growth. You can't make a jaw grow, but you can channel the growth. And here's the big reason why kids are getting braces younger. Girls, we tend to treat too late. Because by the time they have their permanent teeth, they're already young ladies. And of course, that's a very obvious. Just go to any 5th, 6th, or 7th grade class, and the young
girls
ladies
are towering over
yes,
that. Yeah,
and the
my
boys,
5th grader is dealing with that right
absolutely. What you'll find in general is girls are about 2 years ahead of boys in growth and development. Again, as you talk about the 7th grade, especially 6th, 7th, the girls are much taller than the boys.
Right.
So actually treating girls a little bit younger is better for us to take advantage of growth if there's a skeletal problem.
Right.
So again,
Yeah.
the functional needs of a child are important, but we're finding more and more that actually the smile results far exceed the happiness quotient for the patient than their jaw being changed.
Right.
They're all important, it's all important.
Right.
But those are the smile is number one.
Right, how they interact with their friends.
Yes, absolutely.
And I think you've addressed some of the last question a little bit, but I think sometimes, and this is for kids, but also, I think also for adults. I have a lot of adult patients who, who I feel like think, you know what, my parents didn't get braces for me when I was young, and now it's just for vanity. I'm just doing it for looks, and so it seems frivolous, or maybe like I shouldn't worry about it. And I'd love for you to speak a little bit more into some of the other benefits of having your teeth aligned, other than just, the social, psychological, those kind of values for a patient.
Well, I think that's a great question. And I have to just kind of mention a little story. I had a patient of mine who walked in, and they were as old as my father, who's 82 years old. And when they came in, my initial impression is, why is an 82-year-old getting braces?
Yeah.
Or even interested in braces?
Right.
So before I could open up my mouth, I didn't say anything. The first thing she told me, she said, you're probably wondering why I'm here. I'm 82 years old. I said, no, not at all. I didn't think about that at all. And then she said, well, I'm 82. My mother lived to 95, and I want to have beautiful teeth. And I want to be able to chew my teeth well. I want to be able to floss my teeth well. So even though she was already 82, she knew she could benefit from the fact that she could floss better. Again, she loved the smile was a big factor.
Right.
But the fact that she could smile better, and she still said, I have a lot of life to live. I'm 60 years old, and I have a lot of life to live. If I live as old as my dad is now, that's 28 more years.
Right.
So for people to think, well, I'm too old, no. In fact, when you think you're too old, maybe you are, but you're not. You have a lot of life to live. So we treat patients at all ages, and there's really very little that we can't do to improve the aesthetics and the ability to keep your teeth clean on almost anybody.
Right.
Now, there are extreme cases where jaw surgery might be ideal to get an ideal bite, but honestly, you don't have to have an ideal bite.
Right.
Most people don't.
If they've been coping up to that point and they're
Absolutely.
fine. Yeah.
So we can improve, and that's the thing is we can always improve the status of anybody's smile or bite.
Right.
There's actually nobody we can't really treat at any age, provided they have healthy teeth. And that's part of what the Lee Dental Centers do, is that we're not here just to put straight teeth. We're here to look at your overall health.
Right.
So there is a process that we always want to make sure that we have healthy gums, healthy bone, healthy teeth, and then after that, that's where I come in. I'm the smile guy.
Our team helps make sure that everything's healthy enough to withstand the forces of being moved and pushed and pulled around. But that is, you mentioned the health of being able to keep things clean. That's probably one of, outside of just I want them to look nice, that's probably one of the top reasons that we'll have patients pursue orthodontic treatment is they're so crowded on the bottom that no matter what I do, it's hard to get in. Or I have some missing teeth I want to replace, but things have kind of shifted or collapsed in over time. I feel like you're a great adjunct for us to be able to create some space so people can have a more ideal bite and smile.
Yeah, dental care has changed dramatically, and if you haven't been to your dentist in a while, you really need to take the time to come and see what we have to offer. Yeah. It's a great time in dentistry. Things change basically monthly. Yeah. What's one of the nice things about being here, obviously you can see by my beautiful gray hair that I've been doing this a while, and I'm still surprised about how much I have to learn and how much we have to offer.
Yeah. Thank you so much. We appreciate it.
Thank you.
Yeah.
Have a good day.
Thanks for your time.
Nice for you to join us. If you have any other questions, please call in or send it on the internet, and we'll be able to answer your questions for you.
Yeah.
Have a good day.
Thank you.